Good morning, everybody, and welcome to this very special webinar on World Suicide Prevention Day. The webinar is titled Hope and Recovery in the Time of COVID-19. I'm Councillor Louise Gittins. I'm leader of Cheshire West and Chester Council, and I'm the member representative on the Cheshire and Merseyside No More Suicide Prevention Board. I'm really delighted to welcome you all here today. I believe we've got about 300 people attending, which is absolutely fantastic. And before we go on, just a little bit of housekeeping. First of all, to let you know, this is a recorded event. We're going to be hearing from some fantastic speakers, and you'll be able to ask your questions, put forward ideas, suggestions and any issues that you want to do, and you'll be able to do that in the little Q&A box, which on your screen should look like a box with a question mark in it. And you'll have the opportunity as well to like other people's questions, so the most popular ones can get to the top of the list. And any questions that we don't manage to answer during the session, there will be follow-up and there'll be written answers available. If you're using social media, can you use the hashtag that's going out across the world today, which is hashtag WSPD2020. That would be fantastic. Let's get that message out that this is World Suicide Prevention Day. So if we go on to the next slide so that we can actually talk about the programme that we've got. You'll be pleased to know it's not just about people talking. We've got some interesting films to watch. So we're going to start off talking about our 5-year journey as a partnership in Cheshire and Merseyside and the progress that we've made. You'll be pleased to see at 11:15 we're going to have a little comfort break. That will give everyone the opportunity to rest their eyes, get a quick cuppa if you need to. And then we'll go on to talk about building suicide safer communities, and then look to the future and talk about that hope and recovery. And then hopefully we'll be finished by 12 o'clock. So first of all, I'd like to welcome our special speakers that we've got today. Now, we were hoping to have Sue Forster, who is the chair of the No More Suicide Partnership Board and the Director of Public Health from St Helens. But unfortunately, we've all seen in the news the increasing numbers of COVID-19 infections, and she's having to deal with those in St Helens today. But not to worry, we have a great replacement, which is Pat Nichol, who is the Suicide Prevention Coordinator for the CHAMPS, the Cheshire and Merseyside support team. We've also got Sheena Comiskey, who is the Chief Executive from Cheshire and Wirral Partnership Foundation Trust. And finally, we have Jed Flynn, who's the Chief Executive of Papyrus, which looks at the prevention of young suicide. So no more from me, and I'd like to start with the first session on building safer communities, and I understand that we have a film that we're going to show for 5 minutes.
World Suicide Prevention Day 2020 marks 5 years since the No More Suicide strategy was launched. Our vision for the No More Suicide strategy is to transform Cheshire and Merseyside into a region where suicides are eliminated, where people do not consider suicide as a solution to the difficulties they face. 75% of those who die by suicide are men, with those living in the most deprived areas having up to 10 times greater risk of suicide than those who are better off. In Cheshire and Merseyside, we have some of the most deprived areas in England, and also some of the highest rates of suicide. We need to talk about suicide, challenge the mental health stigma, and make sure people know how to get support. Over the past 5 years, we have run many successful campaigns to raise awareness. Over the past 3 years, more than 4,000 frontline workers have completed the No More Suicide community training. The No More Suicide community training targets frontline workers such as welfare workers, barbers and taxi drivers who see vulnerable people on a regular basis. The Zero Suicide Alliance provides easily accessible 20-minute online training that has been promoted across Cheshire and Merseyside and also nationally, with over 1 million people taking the training course since it was first launched in 2017. Youth Connect 5 is a programme for parents and carers to provide them with the tools to build emotional well-being with their families. Developed by Connect 5, the Champs Collaborative and Merseyside Youth Association, 700 parents completed the programme in the first 18 months, with reports of positive changes in their family's emotional well-being. This is just a fraction of what we've been able to achieve since the No More Suicide strategy was launched back in 2015. We would like to thank all of those who've contributed towards achieving the results that we can proudly share with you today. Thank you.
So what I'd like to do now is to hand over to our first speaker, which is Pat Nichol, who's going to talk about today as well, so Suicide Prevention Day and the progress of our 5-year strategy. Thank you, Pat.
Morning everyone, and welcome to this webinar for World Suicide Prevention Day. Today marks 5 years since we launched the No More strategy in 2015. Next, Sophie. So I'd like to take this opportunity to emphasise the vision which was just read out to you in that little clip, that is that Cheshire Merseyside becomes a region where suicides are eliminated, where people don't consider suicide as a solution to the difficulties they face. A region that supports people at a time of personal crisis and builds individual and community resilience for improved lives. So it's emphasising 5 years on, that is still our vision, and our vision is around zero, because preventing suicides is achievable. And every death is one death too many. Next. So over the years, this is the data that we have so far. The 2019 data has just come out. And I would just like to say that there will be some numbers read out today, which we do need to look at numbers, but we always know that each number is an individual loss and a family and friends bereaved. So, you know, just want to bear that in mind as we talk about data. But when we began the No More Suicide strategy in 2015, we just had the year with the highest number of suicides in Cheshire and Merseyside. We'd had 248 deaths in 2014. And we're really working towards that, preventing every death. And for 2019, that number had gone down to 212. So it's slow, but there is a downward trend that we can see. Next. So this slide shows you the rates of suicide per 100,000 in the different local authority areas across Cheshire and Merseyside. And so what we can see from that is, compared to the England figure of 10.1 and the North West figure of 10.6, Cheshire Merseyside has now largely come to be similar to the national North West average, whereas 2 years ago we had many areas that were higher. We can see that St Helens and Halton are slightly higher, but there has been a real change. In 2017, St Helens rate was 17.1 and was the highest or second highest local authority in the country. So there's been a lot of concerted effort to mitigate the risk factors in St Helens. Well, it has across the whole area, but that work in St Helens is really beginning to show a difference. And I know as Sue was presenting, she'd tell you a lot more about that work, but I just want to acknowledge that by working together, we are having an impact. Next. And I've just said that phrase, really, it's working together, and that is actually the theme internationally today, working together to prevent suicide. We have a really strong partnership across Cheshire and Merseyside with people with lived experience, with our fire and police service, community services, NHS colleagues, a whole range of partnerships and services that are all working together to make a difference. Next. So I just want to emphasize that point, but by working together, preventing suicide is achievable. But people really, it's rarely one cause, and no one organisation alone can prevent suicides. But we are fortunate to have so many active and committed partners who are working and collaborating together. And so we've built an effective Cheshire Merseyside structures with our board, and in each local area there's a local suicide prevention group and a plan for each borough, as each area, each community is obviously different. It's a big patch, Cheshire Merseyside, so there's an effective group in each area of Cheshire and Merseyside. Next. So just want to draw attention to some of the things that have changed in the 5 years. What's really changed is that suicide prevention has become nationally recognised as a national health problem for which there is action. And so suicide prevention has been built into the forward view for mental health and the NHS long-term plan. We were privileged to have the Parliamentary Health Select Committee on Suicide Prevention come and visit Cheshire Merseyside. We were the only region that they visited because they'd heard about the activity that's been happening with our partners. And we've been fortunate that we've been able to use the work that's happened locally to influence some of the national work where we've contributed to public health and guidance around local prevention planning, around support after suicide. We've contributed to the NICE guidelines. We've had some fantastic summits where we've been able to have them in person, where Professor Louis Appleby and Professor Rory O'Connor presented. And some of you may have attended last year where Clark Carlisle gave a very moving account of his struggles with mental health. And indeed, it was a member of the community in Liverpool who intervened with his suicide attempt. So we know we can make a difference. And what has changed is that NHS England has provided funding across England towards suicide prevention programmes. So that means we can do more to scale up this vital work. Thank you.
Thank you very much, Pat. I'd now like to hand over to Sheena Comiskey, who's the Chief Exec of Cheshire and Wirral Partnership Foundation Trust. Welcome, Sheena.
Hello, good morning, everybody. Good morning, everybody. It's lovely to be with you, even virtually, this morning. I'm Sheena Comiskey, and I'm the Chief Executive of Cheshire and Wirral Partnership, but I also have the great privilege and pleasure to be the Senior Responsible Officer for the taking forward the implementation of the Mental Health Long-Term Plan in Cheshire and Merseyside. And what I'd like to do this morning is to take you through some of the things that have happened over the last 5 years. We've been able to make the changes that we have through partnership working, Next, please. So as I said, what I'd like to do is to take you through some of the developments that we have been able to do to help support that reduction in suicide and to really focus on suicide prevention. So just a little bit about the mental health programme. So we have a mental health programme board. There are a number of work streams where we focus on what we need to do to further improve the outcomes for the people we serve in Cheshire and Merseyside. One of those work streams is about suicide reduction, but there are a number of other work streams that come together to ensure that the response that we have to people with mental health needs in our population is further improved. And by doing that, that really wraps around that really important infrastructure to ensure that we can respond to people in mental health distress and who have mental health needs. So that is all part of the response to our population. It all contributes to our real focus on reducing suicides. So I'd like to just mention, first of all, the work that we've been doing around improving our response to people in crisis, because obviously that's really, really key to how we respond to people in crisis. And we have been able to, across Cheshire and Merseyside, develop a new care model for adults in crisis, and that's enabled us to have, in all parts of Cheshire and Merseyside, a 24/7 crisis resolution and home treatment teams available to people. The next development I'd like to share with you is around our Beyond Places of Safety, and that's been a really key area where we've worked with particularly our third sector colleagues to think about how do we have different ways of actually approaching meeting the needs of people who are in crisis, so that they're enabled to come together in different ways, which may not be just in statutory organisations, but is also in terms of our great work and the fantastic work that our third sector colleagues do in actually creating those places of safety and somewhere that people can go to actually seek some support when they're finding themselves in difficult places. So the third area I just wanted to mention was around our work we've been doing in terms of our acute hospitals. So clearly with people in mental health distress and mental health needs do present themselves in all sorts of different places within our services in Cheshire and Merseyside, and that's often into in acute hospitals, and actually having a team of expert staff within acute hospitals that are enabled to support people who have mental health needs, and also particularly support in training and developing other frontline staff, so when they do meet people who have needs that they can actually address them and have the confidence to be able to actually work alongside people to help support them and help them with be able to move into recovery and to also support them when they are maybe going through some physical health needs, because often, as we all know, people exist in a holistic way, and we need to look at all of their needs rather than just their physical health needs or their mental health needs. We've been able to also establish our crisis provision for children and young people, and that, as we know, is a really key area in terms of actually being able to meet the needs of children and young people, to help to actually look at particularly our prevention and our early intervention, so that we do come alongside people before they get into having more complex needs, and to really think about how do we do that early on in people's lives. During the COVID period, one of the things that we did very early on in April was to establish very, very quickly our 24/7 helplines across Cheshire and Merseyside, and these are free phone helplines and are for anybody who's experiencing a mental health crisis, and that means that it's provided during that period, particularly when people were in lockdown, a way that they could actually seek help, whether that was just with some issues with anxiety or whether they had much more complex needs, and to be able to have that immediate response, to be able to talk with somebody, and to be able to get support, and be signposted through to support. And sometimes that was into some of our more complex need teams, so that quick access, and also that opportunity to maybe signpost people to other support. So whether that may be somebody who's having relationship problems, or having problems with financial matters. So I think that's a really important helpline that was opened up, and we will continue even beyond our COVID period. Okay, next please. Thank you. So perinatal mental health, so that's support for mums and their families before they give birth, and also in that vital period after people give birth, is a really important area, and we're delighted that we were able to secure funding to improve and increase our perinatal mental health support. And we now have specialist services set up right across Cheshire Merseyside, and we'll continue to develop those, and we'll be adding to those during the course of the latter part of this year. And that's enabled an additional 1607 women to be able to access services. But it's also not just the women, but also their families having that support, to be able to address when women are having some challenges in terms of how they're feeling, and with their mental health. And the next area is around improving pathways in and out of mental health secure services. That's an area of really key importance, in terms of ensuring that we do meet the needs of people who do require more complex care, and care in a very different way to other members of the population. So we have a very important collaboration that's come together called our Prospect Partnership, and that's that opportunity for us all to work together to think about how we improve the experience and the care for people who require secure care, and to think about providing that single point of access and improving that journey for people, and to avoid things like multiple assessments, and wherever possible to try and again do the early intervention prevention work, so that people don't then escalate and require more intensive care. And then the final area I just wanted to mention, which is absolutely key to everything we do, is about ensuring that people with severe mental illness are able to both find, but also that key area of retaining employment. That's really, really important, people being able to retain employment. And we have something called the individual personalised scheme to do that, and that's an opportunity for individuals to be able to work alongside with support with potential employers, but their existing employers, to help think about how they can be supported in what they have adjustments in their workplace, so that they can gain that employment and move forward in their lives. So that's another really key area. So hopefully what you've been able to see through that is our work across the last 5 years to think about how do we come together in partnership, in collaboration with the statutory areas, with our care sector, with people who access our services and their loved ones, and also with the voluntary sector, to really put some key developments in place that are going to support people's mental health and well-being, and enable people to be able to move forward in terms of improving the outcomes in their lives. So that really is just what I wanted to say, and I just really wanted to thank you all for joining us this morning, and look forward to hearing the rest of the presentations. So thank you.
Thank you very much, Sheena. That was a fantastic update. So now I'd like to hand over to Jed Flynn, who's the Chief Exec of Papyrus. Thank you, Jed.
Good morning, everybody. It's a really brave thing to do, to come to a suicide prevention conference. So to all of us, I'm really grateful for taking time to do this. And on my part, thank you all for inviting Papyrus to say a few words. We're very much a partner in this business in the Northwest with you all. I wanted to focus really in my first slide, please, on what we've been doing as a national charity. So I wanted to introduce myself first for a reason, not to be vain or look at me, I'm Sandra D, not at all. But I want to make a key point each of you in this room, each of you in this Zoom is a resource to prevent suicide, not just on the 10th of September, but every day. So in my case, I need to reflect on my lived experience. I lost somebody close to me in my family, which could have been completely devastating and was, but actually over time, life came from that for me and for others, I hope. So I brought an organisation with colleagues over from Australia called Seasons for Growth 10 years after my own loss, and we've educated and worked with hundreds of children, young people and adults to help them navigate change and loss in their lives, and the origins of that programme was suicide prevention. And then 10 years ago, next week, I joined this organisation called the Parents Association for the Prevention of Young Suicide, founded by mums and dads in the Northwest. We're very proud Northerners in terms of our origins. And Papyrus since then, I'll share with you, has grown quite exponentially over the last 10 years. And part of my role today is to be on the National Advisory Group in Westminster. So the next slide, I'll share some thoughts about what we've been up to in the last 5 years. So our strategic plan for Papyrus is very simple. We only do 3 things in order to prevent young suicide. We support, we equip, and we influence. Anything else is not Papyrus. So under the support agenda in the last 5 years, I'm pleased to report that we've been able to expand our professionally staffed Hopeline UK service. I'll say a little bit more about that in the 3rd session, but if you're new to this, Hopeline UK is open every day in the morning, 9 AM, right the way through now, as of today, to midnight, 9 AM to midnight. And we've expanded that in terms of geographic base and number of calls and texts and emails taken as well. We've spent a lot of time honing our products around training and building our physical presence across the UK. So as you can see there now, we're in the Northwest, based in Warrington. We're in West Midlands, based in Birmingham. We're in the centre of London. We're now in Cardiff. And as of 3 months ago, we've been in Belfast too. And we're looking at Scotland probably next. And our influence agenda is probably twofold: social campaigning and political campaigning. Amongst the political campaigns, we've worked very hard in the last few years to change the standard of proof used by coroners, which it has changed the landscape of suicide, because the data that you'll see on people's slides today is probably more accurate than it was up to that point. So let's see the next slide, please. I wanted to share a story with you. A young woman loses her father and says, "What can I do to help?" A young boy struggles with depression and says, "What can I do to help?" A young filmmaker said, "I've got gifts and I've got resources. I want to share them with people because I'm set on fire." That was his words. "I am set on fire with the passion that I see in your people trying to protect people like me to stay alive, to protect them from suicide." So as a result of that, we consulted a number of young people. Primarily, we captured with their permission some of the phrases that young people often use when they call, text or email Hopeline UK. Some of the people we work with in communities across the UK, and this is the result. Oops, we go back, please. Let's try that again. It's just a 1-minute film.
just get an Americano steak out, please?
We're not really going to do that, right?
It's how I feel.
Is it actually how you feel?
Yeah, it's actually how I feel.
I don't know you, but like, that just really, I saw it and it just impacted me a lot. Are you seeing anybody about it?
No.
Why are you putting this on?
Have you got that on yourself? I'm just not feeling so great at the minute. I just feel like I've not really got much choice.
I have a strong sense that spot the signs is not the right language. Suicide, unlike other illnesses and other conditions, doesn't show itself always in manifest symptoms, and a medical model doesn't help anybody. The story behind that is that young people are already talking more about suicide than people of my age, and their co-production has helped many thousands of people now across the UK have conversations like the one we're about to have. So before we go to break, I just want to pose a rhetorical question. The good news is that over the last 100 years, suicide has gone down in number and in rate. And then there are periods when that drop is more acute because of reduction of access to means or new technology or whatever. But at the moment, there is a modest increase in one group particularly, which worries me and should worry you. The suicide rate, that's the number of young people between 15 and 19 of a population of 100,000, is increasing and has done so right the way throughout and slightly before our current 5-year period. My question simply to all of us is why? Why is it that our young people are dying more often than they need to? And that's a rhetorical question, because I think if we start to find simple answers, we put that question away and forget about it. It's not just social media, it's not just exam pressure. As Pat said earlier, suicide is complex. But I think we should do well to pat yourselves on the back for all the work we've done together for 5 years. But as that slide suggests, the work is in some ways only just beginning. Thank you.
Thank you, Jed. That was a really moving film to watch, and it does bring up a lot of questions, I think, and makes you think about your own actions. We have got time now for some questions and answers, but obviously everyone's very shy this morning, so we've only got one question. So while I'm reading the question out, I was going to hand over to Tracy, but I'm quite happy to read this out myself. While I'm reading it out and handing it over, can you all think of some questions to ask these fantastic speakers that we've got here today about the progress of the No More Suicide strategy? So the first question, Sheena, I think goes to you. It says, what will the 1.35 million Beyond Places of Safety crisis funding provide in the region? This sounds good.
Right. Okay.
Did you get that?
Yes, I did. Yes. So in terms of the precise detail of that, I don't have that in front of me. However, what I can talk about is what we've been doing in our local area. So what we have done is to develop alongside one of our third sector partners something called a crisis cafe, which enables people to have a different place where they can come, get support from other people with lived experience, and enables them to seek support and to get that support from others. And we've developed that in St Anne Street in Chester, and that's going to be a really great way for us to really reach out in a different way to people and provide a different way for people to be able to get that support, because sometimes, as we know, people don't necessarily want to come to statutory organisations and want to be able to access support in different ways. So So that's what we're doing locally in the Cheshire West area, and in other areas there are similar things being developed, and in some instances we've also been able to develop what we call crisis beds. They're called different things in different places, which are just a different place where people can come and maybe get some support over a 24 slightly longer period in some instances, and they can come and get some different support in different ways, which means that they are able to access support in a way that might be something they feel more comfortable with. But it is that bit about being able to reach out to people and to actually try and think about how we come alongside people in very different ways. Thank you.
Thanks, Sheena. That's very helpful, and I know the Crisis Cafe is a great addition to the service that we have in the area. Right, I've got another question. I think this is probably for you, Jed. It says, are we seeing any trends in the suicides of young people that we can tackle in any way?
It's really difficult because once I open this up, it gets even more complex. But in simple terms, as I see it, the National Suicide Prevention Strategy for England wisely has 6 or 7 areas for action. The top 1 or 2 are talking about specific high-risk groups, and we fought long and hard at Papyrus back in 2012 to ensure that because the numbers of children and young people were relatively low, they should remain a high-risk group, because the impact and the loss of future years was hugely significant, and that's the case. So we mustn't forget that young people per se, in the fact that they are young people and children, are a high-risk group. Some of the, perhaps at the risk of making some of those facile solutions that I said we should avoid, I definitely think social media has played a part, because the correlation between the opening of Facebook and similar for the last decade has been coterminous with the period during which that rate has consistently been on the increase, albeit a modest increase. But I do think there are some specific tailored approaches we can make. A couple of areas as examples only, not to prioritise them, but young people who identify as non-binary, young people who are on the LGBTQ plus arena, let's call it for now. That whole experience of finding one's identity, sexual orientation, and all that goes with that adds a huge pressure to young people, not least because it's another area of stigma alongside suicide and mental health and death. I also think, again, not to prioritise this group, but I think it's worthy of particular, what we call in the National Advisory Group, a tailored approach, is those young people who are on the autistic spectrum, Asperger's and autism and so on, because I think one of the narratives that I and others have said for many years is you can't damage anyone by talking about suicide. One of the things I learned a few years ago is that is very often not the case when we're talking with children and young people who are not neurotypical in their development. So sometimes young people can fascinate around particular issues, and therefore it is true to say that for most of us, my mention of suicide will not trigger or cause you to think about suicide for the first time. It may give you hope. In fact, we just have to be particularly careful for young people who, as I said, whose development is perhaps not neurotypical. So just some thoughts there for me. It's not an encyclopedic response.
Thanks, Jed. And there's some really positive comments coming through about how powerful that little clip, that little video was, and whether or not you're going to be sharing it on social media and you know, really getting it sort of out there. It'd be good to get it today.
All our films, I'll show 2 or 3 I think today, but there are hundreds of them, well not hundreds, many of them, and they're all on. If you go onto YouTube, Papyrus Prevention is our channel. You'll find them all there or on our website.
Okay, thank you. So I'm going to give a question to Pat now to share them around a little bit. And the question is, it's saying that the person was encouraged to see the number of suicides in Merseyside go down in the new 2019 figures. And why do you think this is? So Pat, if you could perhaps help with an answer on that one.
Hi, yes, it is encouraging that the numbers have gone down slightly, and they did actually go down quite significantly in 2018 as well, against a national background when other areas have gone up. But just like there is no one reason why someone decides to take their life, there is no one action that has prevented people taking their lives. But I suppose, you know, the title of this webinar is about hope and recovery. And I do think that we have some really strong community-based and charity organisations across Cheshire, Merseyside, but in Liverpool and Merseyside particularly, there are some very active organisations. I think the conversation is out there. You know, I'm thinking of Mick Coyle's Mental Health Mondays, and of course Papyrus did some work with them around children's deaths. I just think that we have opened up that conversation in Merseyside, and we've got some very active partners. So hopefully it's that step towards people talking about suicide and knowing where to access support if they find themselves in difficulties. Thanks.
Thank you, Pat. We've got another 5 minutes. So I'm going to ask a question now that's come in that perhaps all of you might want to comment on. And it's, how do we do co-production in such a sensitive and emotive area of work to really make our work as effective as possible? So it's about how we work together, that one. So I don't know if you'd like to comment on that.
I would. I think co-production is key with young people. Many years ago, I worked in learning disabilities, and those of you who do or did remember a phrase which should be on all our lips: nothing about us without us. And I think, you know, we sometimes risk, as Papyrus, doing things like Lady Bountiful to young people, and the more we get them engaged and they write the script, and often the most broken, the most people who are in the most dark place often give us the most beautiful, life-saving activities. So I would really encourage people to work wherever possible with people who would avail of their services. We've learned a lot in doing that.
Pat or Sheena, do you want to come in on that?
Yeah, I suppose Pat here. I suppose I just reiterate what Jed said, that so many people find themselves in a situation of dealing with the difficulty that they've lost a family member or relative to suicide. So suddenly they're in that situation where they need to talk about suicide. They need to find an awful lot of things out very quickly. And the more that we talk to those people who've been bereaved, or those who've lived experience of being impacted, and work together. So that's why we've been working with Wirral Mind, setting up a lived experience network so that we can ensure that those with lived experience are part of all of the programmes that we do. And I'll put my hand up to say we didn't have that at the beginning of the No More Suicide strategy. We did have people with lived experience contributing, but we hadn't established it in a systematic way. So that's what we're endeavouring to do now. So I wouldn't say we've had that right, but I think that the more that we do that, the more that we are able to try and get things right. Thanks.
Thanks, Pat and Sheena.
Yes, thank you. So as my colleagues have already said, engaging with people with lived experience is absolutely key to everything that we do, and clearly it is sometimes very difficult for people to talk, for people to do that, but I think that's thinking and coming alongside people to say, how is it you want to engage with us? What's the most effective way for you to do that in a way that is going to enable you to talk about things and to feel that you can help contribute to moving things forward. And so I think it is about going to people and asking them how they want to do it and how we work alongside people. And that will be all sorts of different ways for different people, because clearly as human beings, we all like to do things in different ways. So it isn't a one size fits all. It is about using different channels, different ways of doing that, and really just doing that together. And doing that together as one. So also I think it's sometimes quite difficult when people have multiple people coming to talk to them. So I think the more we can work in partnership and use people like Papyrus, Jed and all his work to help facilitate that is really, really useful. So thank you.
Thank you, and thank you speakers for answering those questions. And we've got lots and lots of questions coming in now, but it is our break time. Just for the speakers, if you can actually respond to some of the questions. I noticed Jed's done that, and that sort of might help because some of them are probably quite easy answers. So everybody, I'll see you back at 5 to 11, 10 minutes comfort break. Thank you. Hello everybody and welcome back to our webinar, and it's good to see that people are using the Q&A box for some networking. I was actually thinking, how can we do that important networking bit that we always get in a webinar, in a seminar or workshop when we're all together. So carry on with those networking opportunities. It's great to see. Okay, so our next section now is building suicide safer communities, and we're going to start off with the film and then I'll hand over to our speakers.
In Cheshire and Merseyside, we have a no suicide strategy. We want to get it to zero. We feel that there are things that can help people prevent taking their own lives. So as part of the Cheshire and Merseyside Zero strategy, one of the main elements is that we wanted to do some gatekeeper training for frontline people, because every day people come into contact with people, for example, taxi drivers, barbers, and we don't always know that somebody's in distress. Really, when somebody's in distress, they need somebody to speak to them, have a conversation, and hopefully give them the help and support that they need.
We think we've made a really positive impact. So through the evaluations that we've done, we've received case studies from people that have had the training, where they've fed back and said that actually they've had conversations with clients who they've identified as being vulnerable. And actually, because of the training, they've had the knowledge, they've asked the questions, and they've been able to signpost people to services and get them the required support. In that respect, we know the training's had a really positive impact.
So the fire appliance that you see behind us right across Merseyside on a daily basis, and on a daily basis these fire engines are out on the front foot in our communities, and some really vulnerable communities. As we go into people's homes, we go to people's businesses to make them safe. We also respond operationally, and what a great advert for the Zero Suicide Alliance. Our role as firefighters is to keep people safe from fires, of course it is, but we expand that role and we want to keep people healthy and well and alive. So it's right that we concern ourselves with broader public health priorities, particularly around mental health and suicide. And our crews are taught how to deal with those people who might be in a particular crisis at that time. They're also given information as to which agency might wish to engage with that particular person to assist them, so we can keep people in a safe place should they be suicidal or in crisis at a particular time.
I think from a mental health trust point of view, it's important that we are actively involved and that we follow the guidance that's set out from a strategic point of view from the national policy, more locally the regional policy, and working and being part of that zero suicide ambition that the regional strategy entails, but also being visible as well from a local point of view and within our localities are the 3 areas that our trust covers. With all the 3 mental health trusts in the region, ourselves, North West Boroughs and Merseycare, all being part of the Champs Public Health Collaborative working around suicide prevention, we need to continue the good work that's been done so far from a shared learning approach that we have with the other organisations.
Unfortunately, St Helens was the highest suicide rate for males in the country, and as a foundation and for the Rugby League Club, we wanted to help make a difference to people of the town and the community. So we run programmes such as Back into Work and education programmes for ex-veterans and service people. We run fitness programmes for over 35s, a programme called Back On Side, inactive males. We do a lot of mental health workshops, some are done online, some are based here at the stadium. So there's a range of programmes that we deliver all to the people of the community, but it's all based on consultation and need.
Street Triage is a partnership resource with mental health services working with emergency services to get people assistance when they need it in a mental health crisis. So it could be anything from a suicidal crisis through to someone being psychotically unwell, dementia, organic illness, and a range of vulnerabilities. And what Street Triage does, it responds to that need. Some of the mental health crisis doesn't always need a cop. In fact, very rarely needs a cop to support them. What they really want is someone from either a clinical background or someone who better understands their needs to give them the assistance that they require. What Street Triage allows us to do from a policing point of view is get that person early help with clinicians. So it's allowing us to get people who previously we would have struggled to get them assistance at an early stage onto a pathway very, very quickly.
So I think there's a huge stigma around men and men's mental health at the minute, and I think as a charity and as a sport, we've got a real opportunity to actually support a lot of these men, particularly living in deprived communities. For a lot of men who live in our towns, rugby league's an identity to them, so they may not go and speak about the mental health to the GP, to the crisis support team, to the mental health practitioner, whoever it might be, but they will come and speak to us, and they'll go and speak to the heroes and the role models because there's a St Helens badge on it, or a Warrington Wolves badge, or whatever it might be. And if they can actually associate their mental health with something positive, like going to the stadium, like seeing the teammates, like whatever it might be, then actually that's a real opportunity to pull them in to speak about a topic they otherwise probably wouldn't speak about. And actually a lot of the men come to us and say, you know, they came in the first place because it was an opportunity to speak about rugby league and to listen to the heroes, to listen to the role models, who are some of the toughest blokes on the planet and play probably the toughest sport in the world. If they can speak about the mental health, then actually so can everyone.
Fantastic. What a great film, showing all that partnership working with that one vision of zero suicide. It's just brilliant. So I'm going to hand over now to Pat, who's going to talk a little bit about that on behalf of the Champs team.
Hi. Yeah, so I want to talk to you about the No More Suicide vision and the building suicide safer communities. So next slide, please. So hopefully you can hear me. I just think there was a problem with the internet just then. So to deliver on the No More Suicide vision, it calls for a safe from suicide community. So when we started the strategy, we looked at the international evidence around what supports a community to become safe from suicide. And what we discovered was that Living Works in Canada had pulled that evidence together into a framework of 10 pillars, that if you can build those 10 pillars in your communities, you'll be really contributing towards becoming suicide safe. So those 10 pillars are listed there, and we've worked on building those 10 pillars over the last 5 years. And through doing that and recording the effectiveness of it, we were able to submit our evidence to Living Works, and we're able this year to get the Suicide Safer Communities Award in acknowledgement of all those different strands that are ongoing in Cheshire and Merseyside. Next. So as I say, it's about building those foundations in all of our communities. You know, we do work across a wide geographical area of Cheshire, Merseyside, and very differing communities. But if we can build those same foundations in every area so that people have mental well-being skills and suicide prevention through sport, through training, and through many of the campaigns that we've led. And we support safer care in our mental health trust. I know Sheena's spoken a lot around the safer care and the crisis provision, but we've brought together the 3 mental health trusts to work together around how safer care can be delivered for mental health patients. Another key element is support for those bereaved, so that individuals are supported, communities and organisations. And one of the things we first collaborated together on was commissioning the Suicide Liaison Service, Amparo, who worked together with peer groups to ensure that those who are bereaved are supported. And we know that those bereaved are particularly at risk themselves, so it really is also a preventative action to support those who are bereaved. But it's really important that we also learn from all this work and learn from the intelligence and the data we get. So we have annual audits across the whole of Cheshire Merseyside, looking back at what individual stories were, what happened to people on their journey. So we look at suicide audits, but we also now have a real-time data system so that it enables us to rapidly respond and prevent further suicides. So we want to learn from intelligence, and we want to learn from our lived experience network. Those who've been touched by suicide are experts, and so we want to learn from them and embed that learning in everything that we do. But it's also important to link in with national organisations. I mean, such as GED is here as a national lead. We also link in with NHS England, Public Health England, the National Suicide Prevention Alliance and the Zero Suicide Alliance. So all those organisations have learning networks where we come together and exchange on what is working in our different areas. So there's a lot that we're progressing on our 5-year journey, but these are the foundations. Obviously, there's so much more to do. Next, I think. So I just wanted to briefly touch on the real-time surveillance, which does give us timely data of suspected suicides. So we do have to say that they're suspected. And this enables us to do more preventative work with our partners. It ties with the Amparo service, and we've been doing this for 3 years now. So the next slide, please. So just want to bring attention to this year, because obviously we're all very concerned about coronavirus and lockdown, its impact on mental health. So far, we haven't seen a significant rise in Cheshire Merseyside. Coronavirus has been mentioned in 2 cases. We did see an increase in deaths of non-UK nationals, which was concerning and is being investigated. And there has been an increase in Liverpool. So there's variation across the area where there's been some rises. Next. So this slide is just pointing out the data so far to the end of August in Cheshire. We had 75 deaths this year compared to 70 last year, and 51 since lockdown compared to 47 last year. On Merseyside, it was 95 till the end of August compared to 86 last year, and since lockdown, 77 compared to 59 So a bit more of a gap there. The next slide. This just shows the numbers across the months, with the lighter colour being last year and the darker colour being this year. So we did see a spike in July, which has gone down again for Cheshire. Next. For Merseyside, again, the numbers were very much similar until we got to July, and we've seen an increase in July and August. So obviously we're very much keeping an eye on this. Next. Just wanted to highlight one piece of data that we get from having the real-time surveillance. It tells us where there've been deaths in public places, and this enables areas to take quick action. So around we work with the Railways Network, Highways England, housing associations around high-rise buildings, so that we are able to react and put preventative actions in where we can to prevent further deaths. So I just wanted to use that to illustrate that all intelligence is used in order to have a preventative action and make some difference. Thank you.
Thank you very much, Pat. I'd now like to hand over to Sheena from Cheshire and Wirral Partnership.
Hello again. Thank you very much. So what I'd like to do in this section is to really talk about the Safe for Care standards and how we're all working together to move these forward. So the National Confidential Inquiry into Suicide and Homicide by People with Mental Illness has been carrying out research into suicide for 20 years. And they've developed the 10 Safer Care standards by which organisations could use to identify areas for development in their services. So that piece of research work's incredibly useful to all of us to help us further focus on what we need to do to provide that safer care. And the dimensions of that work talks about how we can ensure we have safer wards, how we create an environment where people are able to be as safe as they possibly can, and to actually think about our environments in terms of what's going to provide a much more therapeutic environment for people, as well as a safe environment for people. I think it's also very useful to think about when people leave hospital, what support they get with their ongoing needs, and that's crucial area of care planning with early follow-up and discharge for people for that transition from hospital to community. What are the evidence-based standards that's going to do that in the best way that we possibly can? One of the other areas is about ensuring that as far as possible within the delivery of care that we don't have something called out of area admissions. So those are people who are placed outside of their local area for their care. And as you can imagine, the challenge with that is that it means that people do get dislocated from their communities, from the teams that will provide their ongoing care. So it's how do we all work together to ensure that we reduce and eliminate those out of area admissions. We've talked a lot already this morning about that need to have that 24-hour crisis resolution and home treatment so that we're able to respond to people whenever their needs arise, and that's bit around actually being able to, as far as possible, try where it's appropriate to keep people within their own homes, connected to their loved ones, and to actually ensure that people can come in and work alongside them in that way. That's crucial area about community outreach teams. So that bit around being able to reach out to people who may have lost contact with conventional services, and where we've talked earlier about some of the alternatives to statutory services, that's really, really important to provide those ways of actually people being able to find the right way for them to connect. And then hopefully if they do need that care, that we will be able to ensure that we connect them into services where that's appropriate. That multidisciplinary review and thinking what we mean by that is thinking about how do we come alongside and work with carers and help provide those bridges that are often really, really important and be part of the wider team to support individuals. Nice guidance, there's a lot of really good nice guidance now that actually says how can we have the evidence base to do the best practice that we can, and that's ensuring that we do implement that. The emergency department is an area, unfortunately, where people often find themselves where they come to in times of difficulty, and how do we respond to people in those areas. And as I mentioned earlier about those expertise and specialist expertise to come alongside other key workers in our acute services, so they've got the skills and expertise to actually provide that support in the emergency department. And increasingly important, and I saw in the question, there was a question about primary care networks, is how do we link into primary care, where people often is the first place that they may start to be able to talk about what it is that's troubling them, and people to have the skills to do that and to be able to help support people in those areas. And we know from the evidence that very sadly it's often young men or men who sometimes more middle-aged men as well, who very sadly find themselves in a position where they are troubled and are finding that they need some support. So focus on men's mental health and the work to do that. Next slide, please. So how are we putting this all into practice? As we've taught this morning, and this morning's theme for World Suicide Prevention is about working together. So we've done this working together, and we've taken a partnership approach. And as Mike said on the video earlier, and Pat said, we have actually come together as the Mental Health Trust to work together and to share best practice and to help support each other about how we improve the standards that we are wanting to meet and wanting to ensure that we provide the safest care that we possibly can. So we have got suicide prevention leads in each of our trusts, and they've been able to carry out self-assessments against those standards that I've spoken about, and we've done a lot of work over the last 2 years to really look at those standards. What can we do to improve them? How do we work together and share improvements and do that peer challenge with each other and share that good practice? The two areas that we're particularly focusing on at the moment in terms of the evidence that's come from those self-assessments is around ensuring that we take a really proactive approach to think about how do we further develop support to people who do self-harm, and that's a really key area of our work at the moment, and thinking about how we share best practice about that. How do we support people who are self-harming? And that's things through, for example, the trauma-informed work, and really getting our colleagues together to think about how do we respond to that, and also linking with people with lived experience. And then the final thing I just wanted to mention is around the framework that we developed to take a consistent approach to people with dual diagnosis. So what do we mean by dual diagnosis? Those are people who have both a mental health need, but also have substance misuse issues, and thinking about how do we work together to provide an even more effective response to meeting those people's needs. So and that's consistent offer to 24/7 crisis is again a key area. So that's what I really wanted to share with you this morning about the work that we're doing in terms of thinking about how do we implement those 10 areas that have been identified to really make a difference. So thank you.
Thank you very much, Sheena, and I'll now hand over to Jed from Papyrus.
Thank you. Behind the scenes, what people won't realise is there's some very smooth, slick technical operation going on, and I just hit the wrong button and disappeared and caused panic, but I'm back now. So what have we done to build suicide-safer communities for and with children and young people? I think before I go on, I want to remember one moment about 4 years ago when I realised that the stats did not include those of deaths by suicide of children, and we pushed for the publication of those, and they were quite startling, although relatively low in number. As I said earlier, every child's death, preventable death, is a national tragedy about which we should all do something. So on that note, I want to share a slide that shows a challenge to each of us. The next slide, please. So I've entitled this, oh, it slipped, never mind, Being and Providing Suicide Safer Resources. So I just wanted to suggest to you that you are a suicide safer resource. What might that look like? Being kind, maybe smiling rather than grimacing about COVID. Small things that saves lives. We don't need to have a white coat or a blue light to save somebody's life. And the theme of this year's World Suicide Prevention Day is about working together. And of course, that's about collaboration, about which Pat and Sheena have shared. But I'm thinking about another layer of working together. The lead in suicide prevention of a young person's suicide prevention is that young person, and our facilitating that conversation and working through their uncertainty is our way of being a resource to them, but they themselves are a suicide prevention resource. But I want to share some of our physical resources that are offline and online. So just to pick 3 groups we've focused on during the last few years: parents, educators, and concerned others. So I'm going to share with you, I'm not sure what's happening with the slides, but we can just hold the film. We can just go back, please, if that's all right. Yeah. So I want to share with you, sorry, this is really confusing. If you could just go back a slide, please. I think the music is going to distract people because it's, yeah. Okay, let's go down the slide again. Sorry about this, folks. So my premise is that we are resources. I think I've made that point, but just to focus on 3 actual resources that we've prepared, again, co-producing with groups of people. So we wanted to engage with parents and ask them what it's like. When we talk about improving the online environment, we worked with Westminster Government on their online environment paper, and making sure that the industry keeps the internet a safer place regarding suicide and threats to young people and children. We also worked with schools and colleges to produce 2 guides, Schools and Colleges Guide and the Universities Guide. And this week we've launched a guide based on the reality of many parents who will often go through the system, through primary or secondary care, actually parenting in the dark and not having a clue about self-harm or suicidality. So a little guide produced this week. So now hopefully I'm going to share a powerful film which hopefully speaks for itself, just as an example of a resource we co-produced with parents and young people.
You've got no friends. Everybody hates you. You must get your clothes from a charity shop. Skank. Your hair always looks greasy. Lol. And those teeth look so gross. Like, seriously. You're fat, disgusting, and ugly. I hope you die. Sleep tight, bitch.
It's a very difficult balance for us, isn't it, to share with the public the reality and the prevalence of suicide among children and young people and across the age ranges, and not sensationalize that at the same time. That's a very tricky business, but I think on balance we wanted to ensure that the young people and the parents particularly and the teachers, in terms of our work with schools and colleges, were on side with that need to break into that silence around suicide that many of us experience, particularly when it's one of our own. We don't want to countenance that. So 2 examples there. We worked with, we did a YouGov survey in 2017 with 2,500 school leaders, and it was very interesting what came back, that I would say that people wanted to talk about suicide, wanted to help. The will was very strong, but the skill was not there to match it, and people were desperately saying, please help us. And also, I guess, that sense that teachers were burdened by lots of stuff beyond that which they learned when they were at teacher training college, and the passion waned when they had to burden themselves with other things. So often teachers are saying, I'm a teacher, not a social worker. So the idea behind this building suicide safer schools was really to get them inside with the reality of preventing that horrible picture on the front of that kit becoming a reality, a graduation photograph with no children left. And a quick story about that, if I may. I asked my friend to put that picture up alongside the graduation pictures in his corridor in a very large secondary school in Manchester, and he ummed and ahed and said, that would be difficult, we may get in trouble for that. My question to him and to you is why? And I suggest we need to really work hard on stigma even in 2020. Learning from all of that, we worked alongside Universities UK, and they pledged that every university would take up the offer of our Suicide Safer Communities Guide for young people who are in third level education. So I haven't got a slide to share with you on the third resource I mentioned, but it's just hot off the press this week, and if you want to see it, it's called Support Your Child, and it's for people who haven't lost a child to suicide, have got a young person in their family they're worried about. Maybe they're in the system, maybe they're not, and it's how to engage them and how to think for the first time perhaps about suicide. This does not just happen to celebrities or people out there. It happens, as I started, in families like mine. So without trying to scare you, and recognizing that many of you will be here today because you've had a personal experience of suicide behaviours, fatal or not, let's do whatever we can to continue to have the conversation beyond today about suicide, and that and only that will help to save young lives. Thank you.
Thank you very much, Jed. So we're getting lots and lots of comments and observations and ideas, and I think it'd be good to collate all of these to help sort of feed into our plans. But I have got a couple of questions that I've picked out. The first one probably is for you, Pat, and it's about why we think that the suicide rates for July and August, I think it was in Liverpool, are particularly high, but across the board in sort of June and July. Any sort of observations on why you think that might be? And if any of the other speakers want to come in, then please do.
Hi, when we look at those rates, obviously we are concerned, and nothing comes out as any one particular factor. You know, unfortunately the deaths we are seeing are still those in their middle years. They're still largely men, but obviously we are very concerned that the uncertainty that this year has brought to everyone has increased anxiety, and we are concerned that, you know, as more people are struggling, and the economic impact that may be having an impact. But at the moment, we can't see any one or several reasons outside of what we already know, but we're just sadly seeing an increase in numbers.
Thank you. I don't know, Sheena or Jad, if you want to add to that one at all.
I can't comment on the local data really, except to echo what Pat said, but I do think it's worthy of our reflection. What's it like for all of us to be uncertain? You know, one of our speakers as Director of Public Health had to change path immediately this morning because of a crisis, and that causes stress to her and to everybody. And I think we just have to hold each other a lot more closely at the moment. It sounds a bit pious of me to say that, but uncertainty is the lot of a person who is thinking about suicide. It's our bread and butter, and as a collective I think we just need to acknowledge that it's very uncertain for all of us as helper and helped in equal measure.
That's really good point, Jed. And you know, I'm thinking about how the community have come together to deal with the COVID crisis, and how we can use that sense of community and all those volunteers in a positive way going forward as part of our hope and recovery. And maybe that's something that we could have a look on. I have had a specific question about St Helens, which has got the highest rate of suicides in the region. I wondered if there's anything specifically that we're doing in St Helens to try and address that, and that's for anybody to comment on.
Unmute myself here. I'll come in on that. And obviously Sue Forster, the Director of Public Health, would have had a lot to say on that. So it is higher than the other regions, but I say it is coming down. There's a multitude of actions happening in St Helens, whether that's through sports, through communities, or through closer working with the NHS. It is just a sad reality that that area has had higher deaths, particularly in men. So there is, I know it's repeating this, there isn't any one particular thing, but there is an awful lot of activity that's happening, as well as the Director of Public Health. There is a suicide prevention lead who has a local group who's doing a lot of work in partnership. So the effort is there, and we're just working towards that number coming down for this year and onwards.
Thank you, Pat. I don't know if Sheena or Jed want to add to that at all.
No, so I think really just to echo the fact that it is about it's a multifactorial issue, and so it's really important that we look at how we bring together all the different aspects of supporting people, which is really where I think it links very nicely into the bit around the theme for the international theme about working together, because it's how we all work together to try and tackle some of the issues and causes that are there. Thank you.
Jed, do you want to come in? Are you okay?
No, I think it's all been said. Thank you.
Okay, that's great. So we are going to have to move on. So now we're going to watch a film. I haven't seen this, so I'm very excited about it. It's come all the way from Living Works in Canada, and it's a congratulatory video for us in Cheshire and Merseyside on us achieving the Suicide Safer Communities Award. So look forward to this film.
Greetings from Canada and Living Works Education. As we recognize World Suicide Prevention Month in 2020 and the important roles we all have in suicide prevention, I'm pleased to share a few minutes with you. I'm Richard Ramsey, co-founder and President Emeritus of Living Works Education. Today, it's really my pleasure to offer my sincere congratulations to Cheshire and Merseyside on attaining the Suicide Safer Community Award, the first sub-region in England to do so. I extend particular accolades to the leadership of Pat Nichol and Sue Forster for their lead roles in coordinating the region-wide partnership approach to suicide prevention when achievement of the Suicide Safer Award was made the top priority in 2015. The foundation for the region's dedicated commitment goes back to the launch of of England's UK leading national suicide prevention strategy in 2002, and the long-standing leadership of Lewis Appleby and Public Health England. LivingWorks is really proud to have participated and partnered with Mind Lewis in 2004 to present our first T4T in England, and congratulate you for your tiered approach to a network of safety trainings throughout the region. Today, I know that Cheshire and Merseyside stand proud in having helped pioneer the zero suicide movement in the UK, as we in LivingWorks are in having been training partners in 3 of the 4 founding approaches to zero suicide in America: Magellan Health in Arizona, National Suicide Prevention Lifeline, and the U.S. Air Force. If I may, a few minutes and comments on the origin of the Suicide Safer Community Award. It goes back to the late 1980s when the concept of safe communities originated in Sweden to address both intentional and unintentional injury prevention around the world. Injury prevention safety was a growing priority back in those days. Over time, though, the focus has tended to drift toward unintentional injury or accident priorities. With our training focus on safety and challenge, we coined the concept of suicide safer living in the 1990s, recognizing that suicide experiences are part of the human condition, not something to deny or silence. To give suicide injury and safety more of its own voice, we introduced the idea of Suicide Safer Community Initiatives to parallel International Safe Community Awards. I extend a special thanks to Suicide Safer Living initiatives led by grassroots founders in Brighton Hove in the early 2000s. In a way, their efforts was a pioneering way that helped pave the way for today's award to happen. We hope the future will see networks of suicide safety become a natural priority in communities around the world. From a sub-region context, Cheshire and Merseyside have modeled what can inspire other regions to do what works for them. There are very few certified safe communities in the UK. It wouldn't take much for your model to be an injury prevention leader across the country. I conclude my congratulations with a parallel to the constantly repeated pandemic messages of working together that we're also familiar with today. Wash your hands, practice social distancing, wear your mask. Going forward with advances in networks of safety, I encourage Cheshire and Merseyside to never wash your hands of suicide. Never distance your community from someone with suicide experience. Never mask your community's belief that suicide is part of the human condition. Always believe suicide safer living and networks of suicide safety are priorities in all community-based injury prevention actions. Congratulations.
That was great to hear from Richard all the way from Canada, and it's good to, on World Suicide Prevention Day, to think about those people all over the world who are doing exactly what we're doing now, perhaps with a bit of a time lag, but certainly that's going on across the world. And actually I can feel the power of that. I know it sounds a bit corny, but I think it's just amazing. Okay, so we're moving on now to our final session, which is Hope and Recovery in the Time of COVID-19. And this is about how we're going to move forward. And it's all about hope, and hope is such a powerful word to use. So first of all, I'd like to hand over to Pat to give her introduction to this.
Okay, thank you, Louise. I think my video's frozen, so you'll be relieved you just got my voice here. But anyway, so we are going to talk about hope, but at first just looking at the factors that are giving us all concern, because we know that COVID has perhaps exacerbated some of the factors that we know do contribute to a risk of suicide. obviously lockdown contributed towards loneliness, perhaps people feeling that they're a burden to their family, and a sense of hopelessness, and for some people a fearlessness about dying. So those factors have been accentuated around COVID. And we do also know that levels of anxiety, depression and stress have increased. Obviously there's the trauma of bereavement and developmental and behavioural concerns for children and young people. So we do know it is having an impact, and it's also having more of an impact with our vulnerable people, our vulnerable communities, issues around the economy, social relationships, alcohol and drug abuse, domestic abuse. So I just think we do need to acknowledge there is a significant impact there, but that doesn't mean that a rise in suicides is inevitable. So next slide. So we can work in hope towards recovery. And one of the points, we do work with the Samaritans Media Advisory Service, who support us in ensuring that our local media doesn't report in a sensationalist manner. So we know that can be triggering to people. Obviously, we look to the government around welfare and employment schemes around protecting people's finances. Frontline and key workers being supported. Mental health providers have really acted quickly to offer virtual service delivering crisis helplines. There have been campaigns around domestic abuse and about looking after your mental health and self-care. The bereavement support has gone on online, and obviously it has been emphasised the support for young people and carers. And perhaps most importantly of all, it's how communities support each other and support those feeling alone. Next slide. So I just drawing attention to a source of hope and a source of moving forward in terms of our communities. In the last year or so, we've seen a real range of community action, particularly encouragingly by men for men. Such we have Sean's Place in Bootle, Paul's Place in North Liverpool, James's Place in Liverpool, Journeymen Evolve on the Martin Gallier project on the Wirral, Number 71 in Chester, and the range of sports programmes that you've heard about already. So I think that's really encouraging that people are initiating projects, programmes, charities in their own locality that are going to really make a difference, particularly towards middle-aged men. And we've been fortunate to get some NHS funding towards seeding further community action for men's mental health projects. So we're in the process of distributing that to local communities across the whole of Cheshire and Merseyside. So that's one aspect and one area that gives me hope that our communities are addressing this and are going to make a difference. So thank you. So my last slide is just to remind people of the Stay Alive app that actually Grassroots developed, which you can look at and utilise for if someone's thinking about suicide or you're worried about someone. So please do have a look at that app. Thank you.
Thanks very much, Pat. And now over to Sheena.
Hello again. So what I'd like to do now is to just share with you some of the things that we've been able to take forward from our learning in the COVID period. So as we've already talked about this morning, clearly it has been a very, very difficult time for people being in the COVID context and the impact on people's mental health and well-being as a result of that. However, because we've had to work very differently, we have been able to do some rapid innovations and really move things forward to respond to meeting people's needs in a very different way. So what we're very, very keen to do is to ensure that we build in those innovations and take those forward. And within our trust, we have been doing an evaluation of what's worked well during COVID. And we've done that by working with people who've been accessing our services with lived experience to understand what their experience has been, with people providing care, and to just see what innovations have worked well, which ones we want to continue and build on, and those that haven't been as helpful as they could be on an ongoing basis. So in terms of some of the things that have worked very well are things about providing a digital alternative to face-to-face contact, and particularly to think about those opportunities there are for people to access services differently and to be able to have that access in a way that might be even more attuned to how they want to be able to interact with services. We are, however, very mindful in terms of that the way people access services may not be the same for everybody in terms of their opportunity to do that. So we are very clear that there is an issue with digital poverty, and the fact that we do need to make sure that those people who don't have access to either IT or sometimes people don't even have connections to the internet, is how do we support those people, and how do we make sure that we don't further increase inequalities for people in our society. So the next area I'd just like to talk about is in terms of extending support to communities, including schools. So clearly we've already talked very importantly this morning about children and young people's mental health and well-being, and we know that because schools have been locked down and people have been attending, that children and young people have found themselves in some cases quite isolated. It has been quite anxiety provoking, so we've been ensuring that we come alongside schools in terms of our mental health support teams, working with schools to give them resources to help support children and young people, being able to have virtual consultations with schools and families to help them support people with anxiety and other mental health issues, and actually extending physical resources to schools through things like some information packs and in enabling people like school nurses to have some further skills in dealing with anxiety, depression and self-injury, and also to work with third sector partners like Kooth and Healthbox and other people to provide those resources, as well as a key focus on online resources for things like My Mind website and other areas where people can access some support through digital technology. I've talked about the need to ensure that we do address health inequalities, and we now have a framework about how we're going to work through 8 key areas to support reducing inequalities and really focusing on how do we really address those, because really unfortunately COVID has shone a further light on the health inequalities that exist in our society, and how we can think about having a very targeted approach to reducing those. We know that staff working in both health and care have had the period that they've been working has had an impact on people's mental health as well as their physical well-being. And across Cheshire and Merseyside, we are now are in the process of operationalising or starting a resilience hub, which will provide support to people that they can access that. And we also have, as you know, lots of other resources like Kind to My Mind and other areas. So I think the most important thing in all of this is the spirit of collaboration, how we work together, how we learn from that bit about one of the things that I think was very positive in COVID was that working together, that coming together with a common purpose to ensure that we really support people. So thank you.
Thank you very much, Sheena, and finally I'll hand over to Jed.
Hope and recovery is our bread and butter, I hope, for all of us, giving people hope and sharing our own. Let's watch this film.
Is there anything else I can get you?
No. Yeah, can I talk to someone, please?
Okay, next slide, please. I think it's really important while we're talking about other people's recovery that we remember our own. 10th of September for the last 12 years has been the busiest week of my life, and last year I determined that if I was to survive the next World Suicide Prevention Day healthily, I would take half of it off and look after me. And my message to you today is, firstly, thank you for being part of this. I'm sure it will have inspired something in you. If it's made you angry or sad or happy or fearful, just staying with those feelings today and looking after yourself. And if I may prioritize you, think of something that you can do today to self-care, and together, working together, I want to focus as well our thinking on mutual care. We need to reach out to each other. And I really mean that. Today, if I may challenge you, as Richard Ramsey said, challenge and support. I would support you to look after yourself. But I would challenge you to reach out to somebody who crosses your mind today and just say hello, that's all. You never know, it might help them to do what we're in the business of doing today, preventing suicide. And my last slide, I think. Just to say thank you. And I know this is not a sales pitch for Papyrus, but like many of the organisations represented in this room, we're a collaborative, we work collectively with others. So if you can do anything to work with us, please pick up the phone, give us a shout, and together we can help to save young lives and protect life. However slim, however thin that is for some person today, something that you'll have heard or said today may help spur you on to reach out and help them to stay alive. Thank you for listening.
Thank you, Jed. That was extremely powerful film that we saw then. I'm conscious that time is sort of pressing on, so we've got some questions around collaboration, and in particular how we can link in more with things like drugs and alcohol services, and it's all that sort of joined up thinking. So I thought I'd just throw that final question out. There's still lots of observations, ideas still coming in, but I think if we could just think about how we can work together, perhaps with services that haven't been involved in our partnership in the past, how we can reach out and pull those in so that we can all work together. So any thoughts on that, and then we'll go to the final film. Don't know if anybody wants to come in first. Sheena?
Yeah, I mean, a great point, Louise, about how do we ensure that we reach out to people that can help support that collaborative work. So we've got within our trust, and I know Kathy's online now, Kathy Walsh, who works in our sort of partnerships and place, and I know Kathy will be wanting to use all sorts of different ways to reach out and make sure that, that we do things very collaboratively, that we work very much with our third sector colleagues, and do that. And I think I would just say to people, just come and knock on our door, and we will keep that door open and welcome all of you as part of our collaborative work. Thank you.
I'll just say a word, Pat, here, that you know, collaboration is written through a piece of rock, but you know, we can't be everywhere. But what we can do is support people in the skills and the knowledge and the ability for people to do things themselves. But there is, particularly with alcohol and drugs, there is the work going on around dual diagnosis, so that even if it hasn't been featured in the work today, there is an awful lot of work that is happening across many different areas. There's always more to do, but I think if we can provide those skills and knowledge for people to take the No More Suicide message into their own organisations and their own partnerships, then we'll have done more to scale up this work. Thanks.
I just name check the National Suicide Prevention Alliance as well. Sometimes getting an organisation on board from HQ, if it's a national organisation like a drugs charity or whatever, that's really important. And locally, I don't think we should underestimate the power of local authority sort of footprints, suicide prevention partnerships, especially where there's lived experience there. The hell hath no fury like a bereaved person, let me tell you. So I think if there's a connection at all to be exploited locally, we should bring partners together.
Thank you very much, Jed. So we are running out of time now, so I think it's probably a good idea if we can move on to our final film, Hope and Recovery. Thank you.
Cheshire and Merseyside is a region where people can experience many challenges. Whether they're financial, social or personal, they have the potential to put mental health at risk. However, it's also a region of strength where individuals, communities and organisations are collaborating to build a better and a safer place. Preventing suicide can't be achieved by one agency alone. There are many organisations reaching out to connect, support and offer hope to those who are vulnerable, and we are proud to work in partnership with them to prevent suicide across Cheshire and Merseyside. Here are just some of the campaigns, organisations and resources that will help to keep people safe from harm. We encourage you to share these with your networks. Let's move forward with hope together.
Thank you very much, and I found this a bit of a roller coaster this morning, and particularly the final sort of comments from Jed around self-care and looking after ourselves. And I think that is such an important message, and it's certainly one that I'll be taking back to the council as my sort of contribution for today, that we do need to look after each other. We need to look after ourselves. So that's something really powerful. And I think what we all need to think of from today is, how can you be inspired from today and from the things that you've learned to actually further the work of preventing suicides in Cheshire and Merseyside. And whilst I'm just doing my closing remarks, please use the time to put any more comments or anything in the chat box so that we can collate it all and try and move forward together in hope and recovery. I'd like to say a huge thank you, not just to the speakers for their contribution today, but also we've got a small army of people in the background making sure that the technology worked today. There's been a lot of planning and preparation going in to make sure this has been a successful day. And I hope you've all found that you've been inspired from this. Just a reminder, please promote the Stay Alive app with your networks. Networking is so important, spreading those messages out and using social media to get those messages out to everybody. So I'm not going to carry on any longer. Just a big thank you for everyone who's attended today. As with all of these things, you will get a little survey to ask how you found it, so that to help us improve future events. So thank you all. Stay safe. We're going into a really difficult time, I think, with COVID, and please look after each other. Thank you very much for attending today.